Welcome back. As we mentioned earlier, tonight we're looking at national healthcare insurance. The World Health Organization reports that good health is essential to sustained economic and social development and poverty reduction. But one of the biggest barriers to accessing quality healthcare, both locally and globally, is its cost. In South Africa, access to healthcare is split between the private and public healthcare systems, with the larger population relying on public government-funded healthcare. One of the United Nations Sustainable Development Goals is that all UN member states try to achieve universal health coverage by 2030. In South Africa, the National Health Insurance White Paper was approved by Cabinet and gazetted by government at the end of June. But what does this mean for South Africa and access to quality healthcare? This was one of the topics at the 18th Annual Board of Healthcare Funders Conference this month. Our city attended the conference and spoke to Dr. Ali Hamdulay, chairperson of BHF and the CEO of Metropolitan Health, and asked him to unpack the topic for us. Let's have a look.
Hi, Nicolette Hartman with Our City News from Cape Town TV. We're at the 18th Annual Board of Healthcare Funders Southern Africa Conference to talk to Dr. Ali Hamdulay about national health insurance. As the chairperson of the BHF and the CEO of Metropolitan Health, what exactly does your job entail?
As chairperson of the Board of Healthcare Funders, BHF, my job is to manage the board in terms of the governances. But BHF in itself is a representative body for medical schemes in the country, as well as healthcare administration businesses and managed care organizations that supply services to the Board of Healthcare Funders. And as such, Metropolitan Health is one of those administration and managed care organizations that provide services to medical schemes in the healthcare industry.
Please explain the current status of healthcare in South Africa.
The current status is that we have a two-tiered system, if you could call it that. One where you have a private sector that functions to serve predominantly members and beneficiaries and patients that have medical aids. And then you have the public sector, which is the other part of our health system. Within the private sector, there are about 8.9 million lives that are covered under medical schemes. And that constitutes roughly about 16% of our population. So that means 16% of our population are covered by health insurance cover, and the rest of the population is dependent on the public sector as such. And so when you look at our GDP spend for health, those are split. Our spend is about 8% of GDP, 4% being spent on 16 million lives, and the other 4%, on the balance. So there is an imbalance in our country that, we believe that universal healthcare, national healthcare insurance can address to solve for us.
What are some factors that help estimate the cost of national health insurance?
It's very difficult to put the numbers together. And so there are different models that are being explored to understand exactly what it would cost. And those costs are dependent on several factors, some of which are controllable, and others, based on the economy. And we can understand that with, volatile economic environments, it's not always an easy prediction to make. And so some of the ways that, have been proposed in terms of raising revenue, I think the immediate conversation or the current conversations is around using tax credits that currently account for about 20 billion rand, where the government is sort of subsidizing medical scheme cover. And so that monies are being mooted as an opportunity to raise some funding for national health insurance. And then the conversations have been centering around potential tax, additional income tax. There have been discussions around VAT, but the VAT, increasing your VAT rate does affect the poor a bit more. So we've seen in some countries where NHI has been implemented that they use a bit of a balanced environment. But it depends on the demographics and the employment rate of those particular countries.
We're in the second phase of implementation for the white paper. Could you explain the white paper and what this phase entails?
So if you don't mind, if we start right at the beginning, in 2007, the ruling party pronounced the fact that they wanted to implement a national health insurance. So, the conversation started at that point, and we as an industry then had to consider what that would mean for us. And what the Department of Health indeed is, they preceded the white paper with a green paper, which just formalized the policy and the thinking and opened up the door for comments and inclusion in terms of that conversation. That was then followed by the white paper.